Okay, so let's start with our antihypertensive agents. Pickle 1 concentrated on Simpa and Parasimpa, and you ended with CNS drugs. Now, for Pickle 2, we will be having cardiovascular drugs. Okay, and that means we are starting with antihypertensive agents. Now, how do you define hypertension, class? How do you define hypertension? Manawag ba ko or mo answer na lang mo? Or mutubag na lang mo? How do you define hypertension? Increased BP. Okay. Increased blood pressure. Okay. High blood is a layman's term for the condition. Again, high blood is a layman's term. Layman's term yan siya. Anyway, when you say hypertension, that is increase in blood pressure. And take note that hypertension remains to be the most common cardiovascular disease. We have a lot of cardiovascular disease, but the most common one is hypertension. And our problem with hypertension is that because of the increase in the blood pressure, it will lead to damage, example, in the blood vessels of the kidneys. So, ano yan siya? Yung may problem with hypertension kung na-observe nyo or meron kayong nakita or meron kayong alam na person with hypertension, as the hypertension gets uncontrolled, the kidneys might be damaged. So, pwede sila magkaroon ng kidney failure or renal failure. And then, aside from the kidneys, the blood vessels in the heart might also be damaged. So, leading to heart failure. So, maraming sequelae, maraming consequences ang uncontrolled hypertension. And at the same time, it also may lead to damages in the blood vessels of the brain. So that is why we also have patients experiencing very high blood pressure that leads to stroke or aneurysm. Okay? So that is again damage to the blood vessels sa brain. I hope that is clear. Now, how do we classify hypertension? So please take note of this. Ito yung ating guide, the JNC8, I think ito. JNC8 ang tawag nito. Ang nagbigay ng classification of our hypertension. So sa taas, you are very familiar that is called the systolic pressure, and yung sa baba is called the diastolic pressure. We use the unit millimeters of mercury. Now take note, what is the normal blood pressure? The normal blood pressure should be less than 120 and less than 80. Take note that should be both systolic and diastolic pressure. Okay? So again, both yan have both systolic and diastolic pressure should be normal for you to be considered having a normal blood pressure. So once again, our normal blood pressure is less than 120 over 80. Now, how about if your blood pressure is 110, but the diastolic is more than 80? Again, are you considered normal for that? Or do you have a normal blood pressure if your blood pressure is 110, but the diastole is more than 80. Normal or hindi?
Dili, ma'am.
Okay,
Dapat
very
80.
good. Hindi. Hindi normal yung blood pressure even if the systole is normal but the diastole is more than 80. That cannot be considered normal. So gaya ng sinabi ko kanina, that should be both systolic and diastolic pressure. na magi less than 120 and less than 80 respectively for you to be considered normal. If it's the other way around, for example, your systolic pressure is less than 120, no, your systolic pressure is more than 120, but your diastole is below 80, that is still not normal, ha? Kasi the systole is high, even though the diastole is like normal. Hindi siya matatawag na normal blood pressure. Now, take note, if you have a blood pressure between 120 to 135 for the systole and then 80 to 89 for the diastole, that is called pre-hypertension. So what does it mean? You still don't have hypertension yet, but you're going there. So again, that is called pre-hypertension. So please look at your blood pressure kung saan yan siya nagfo-fall. Again, pag 120 to 135 lang or 80 to 89 yung diastole, pre-hypertension pa ang tawag dyan. It's not yet hypertension. You are not yet hypertensive, but it's not normal. You're in the borderline, okay? Borderline for the disease or for the condition. Now, pag pumatong yan ng 140 and higher and 90 and higher also, that's the time you will be diagnosed with hypertension. Okay? More than 140 over 90, that's when we call it hypertension. But we have stages of hypertension also. If your blood pressure is 140 to 159 over 90 to 99, that's stage 1 hypertension. But if it's higher than that, more than 160, more than or equal to 160 over 100, that becomes stage 2 hypertension. So, what are you going to do now? You have to memorize this table, class, kasi this is really included in our board exam, and we really have to know the different stages of hypertension. Okay? Pero hindi naman na isang kuhanan ng blood pressure pag naging 140 over 90 yung BP mo, hypertensive ka na agad. Meron tayong tinatawag na algorithm for that. Meron tayong tinatawag na algorithm na ginagamit ng mga doctors for them to diagnose if you really are hypertensive. Let me show you this. It's maliit pa lang. Wait lang. Check ko muna if kaya ba siyang palakihin. Hindi pala siya. Mag-pixelate ko. Mag-pixelate pala talaga siya. Wait lang. Hanap ako na. Meron kasi akong algorithm nito. Naka-save lang sa laptop. My problem is, maliit pala ito. Ito na lang. Dito na lang siguro para malaki siya tingnan. Hope you can see it, this one here. I don't know how I am going to make this like larger. But anyway, this is how they diagnose hypertension. So take note, elevated blood pressure readings either in the office, at home, or in pharmacy, or the hospital, or clinic, kasali na dyan. So hypertension visit 1. The doctor will be doing this history taking, physical examination, and diagnostic test. When the BP gets more than 180, that's more than or equal to 180 over 110, automatic class, the person is diagnosed as hypertensive. hypertensive. Okay? Automatic ha, if pag-visit una or pagpa-check una ng BP more than or equal to 180 to 110 agad. That's hypertension. Now, pag hindi more than or equal to 180 or 110, but it's like ang AOBP means automated office blood pressure, and OBPM class is called um office blood pressure measurement. If it is more than or equal to 135/85 or more than or equal to 140/90, dito tayo ha sa baba. Pero pag hindi, mababa pa dito, meaning mas mababa pa sa 135/85 or 140/90, walang hypertension yung person. But it needs to be ano pa rin, checked annually. Pero if yes, pumatong ng 140/90 or 135/85, further testings should be done. So out of office assessment, meaning the patient may have ABPM, which is preferred ambulatory blood pressure measurement, pwedeng sa clinic or sa hospital, para ma-check. Kasi sa office itong OBPM, AOBP ha, kung nasa work ka and then your blood pressure is checked. Ganon. Kung tumaas siya, pumatong ng 135/85 or 140/90, preferred yung punta ka ng clinic, punta ka ng hospital for you to have the ABPM. Okay? Magpa-check ka or HBPM na diagnostic series, meaning HBPM is home blood pressure measurement. If you're not going to the clinic, then you may do the monitoring at home. Okay? So, hypertension visit 2. After 1 month, if you are going to be tested again with your blood pressure or within 1 month, I mean, if your daytime na blood pressure is more than 2 or equal to 135/85 or the 24 hours nimo na blood pressure is more than 130/80. So series of like monitoring of the blood pressure within the day, again, is more than or equal to 135/80 or 130/80, or yes, you have hypertension. Pero pag hindi class, hindi umabot sa blood pressure measurement na yan, ito yung tinatawag na white coat hypertension. If the average na blood pressure of the patient is less than 135/85, it is advisable to perform or repeat the measurement at home or in the office. Kapag hindi talaga siya tumataas ng 130/80, walang hypertension yung ating patient. Therefore, class, hindi mo matatawag na hypertensive ang isang tao if sa isang monitoring lang or isang measurement lang mataas ang BP niya. Unless na lang, sabi ko kanina, dito sa automatic hypertensive, kapag umabot dito yung kanyang blood pressure. Automatic hypertensive siya. But again, if not, hindi umabot dyan, series of monitoring should be conducted in the office, at home. When you say in the office, during work, and then at home, you can also do that, or you can have ambulatory blood pressure monitoring. When you say ambulatory, that's in the clinic, okay, or in the hospital. Pero you are not going to be confined. So series of monitoring yan siya. Kapag the series of monitoring is mababa talaga yung blood pressure mo, less than 130/80 or less than 135/85, then you don't have hypertension. But if series of monitoring mataas talaga siya, nag-i-increase talaga siya or higher than 130/80 talaga, then that's the time you will be diagnosed with hypertension. hypertension. Okay? So that's how they diagnose hypertension class. Do you have questions? Siyempre, hindi tayo mag-diagnose no kasi we are not doctors. And diagnosis is not included in our work, okay? Or our responsibility. Do you have questions? In all ages. Yeah, in all ages. Bata man or matanda. Dati, yung blood pressure, yung hypertension has become a disease or condition sa mga matatanda. Pero that's not true nowadays kasi we have a lot of like young people who are diagnosed with hypertension. So that may be due to lifestyle, to our lifestyle. Meron po. Anong meron? Sorry, anong meron po? Merong ano? You just send your questions at chat. That will be under here sa stage 2. Okay? Stage 2 yun. Baliktad pala yung sinabi ko last time. Di ba I told you na I'm going to check the hypertensive crisis. So urgency if there is no organ damage during diagnosis, and if the patient has organ damage, emergency ang tawag. Okay? Hypertensive emergency. Stage 2 na kasi masyadong mataas yung BP ng person with hypertensive crisis. Okay? So what are the positive factors that will contribute to having hypertension? So number 1 there is smoking. Class, nicotine is a chemical substance. Actually, it's a phytochemical from the plant. It's actually an alkaloid from the plant, like Nicotiana tabacum. But again, nicotine is a chemical substance that has no therapeutic activity. It has no pharmacologic activity, or what do you mean by that? Wala siyang clinical application. Again, nicotine has no clinical application. However, nicotine is used by people to be stimulated. So that is the reason why they smoke. But as they smoke, they get addicted to it. Kasi nicotine is an addictive substance. Now, aside from being a stimulant, it has no other clinical application na beneficial for us. Instead, nicotine class targets the cardiovascular system. Okay, again, nicotine targets the cardiovascular system. Therefore, if the person is a smoker, there is a very high chance for him or her to have hypertension even at a young age. Okay? Aside from having hypertension, since hypertension has sequelae, the patient may also experience problems with his or her own heart, or if the blood pressure gets uncontrolled, alam nyo na yun, it can damage the kidneys and the blood vessels in the brain also. So if you know someone who is a chain smoker, I hope we can advise them. Actually, they know that. They know na wala naman talagang good effect yung nicotine sa body, pero hinahanap kasi talaga ng body nila. But if they are able to prevent their like craving for the nicotine, then I hope they can do that. You can advise them to stop. But since they are chain smoker, they should not stop it abruptly kasi mag-withdrawal sila. So pwede silang mag-gradual taper ng dose pababa until mawala sa system nila. Kasi that's the number one positive risk factor to having hypertension. Now, aside from that, we also have metabolic syndromes. Just like when the person is obese, again, that will contribute to having hypertension. Dyslipidemia also, when you say dyslipidemia, that's abnormal number or abnormal amount of lipids in the body. So it may be the cholesterol or the fats. Pwede yun siya. And also diabetes can also contribute to having hypertension. Okay? So what happened? Sa diabetes, you have a lot of sugar in your blood that makes the blood sticky, viscous, and that may contribute to the inability of the blood to flow efficiently. So mahihirapan siya mag-flow, leading to the increase in blood pressure. That is also true for obese and patients with dyslipidemia, especially cholesterol clots can deposit to our blood vessels. It's what we call atherosclerosis. So again, when they deposit in the blood vessels, that will make the blood vessel narrow, and that will also hinder the efficient flow of the blood. Okay? That is why metabolic syndromes are also considered positive risk factors to hypertension. And then we all know that family history of cardiovascular disorder is also a positive risk factor. Therefore, if in your family there is someone or there are like family members who are experiencing hypertension or other cardiovascular disorders like heart failure, most likely class, meron din kayong ganyan. Mataas din ang chance na makukuha nyo din itong condition na ito. Okay? Kasi nasa genes natin yon. However, since hypertension is a lifestyle disease, then we can choose when this disease will come out. Okay? So if we are going to have a good lifestyle, even though na ang hypertension sa ato ang genes, we can enjoy our like younger days. Kay dili pa na siya mugawas. Sa sunod pa na siya mugawas kung tigulang na ta. Pero kung hindi tayo hindi natin babaguhin ang ating lifestyle, then bata pa lang tayo, talagang lalabas at lalabas itong condition na ito. Okay? Another positive risk factor is like end organ damage at the time of the diagnosis. So example, the patient has kidney failure. So pag na-damage yung kidneys class, most likely it will affect the blood pressure of the person. So that contributes now to the patient having hypertension. So ito silang lahat positive risk factors of hypertension. Do you have questions? Baka may gusto kayong itanong? Wala? Sure? Saba ako. Ako ang electric ban. Wala? Sure na? Balik na magkatulog din ha? Now, let's talk about the etiology of hypertension or the origin. We have two types of hypertension, the essential or the primary hypertension, which we believe has a known cause. And then, most of the people having hypertension class actually is classified here sa essential or primary hypertension. Though, meron tayong positive risk factors. Again, these are the factors that will contribute to having hypertension. But if that is the case kasi, magiging unknown pa rin ang cause. Bakit tumaas yung blood pressure niya? So, under pa rin yun sa essential or primary hypertension. Now, the second one is secondary hypertension. Unsa gani si nicotine? Nicotine is an alkaloid, a plant material from Nicotiana tabacum, and it's a chemical substance that has no clinical application, no beneficial clinical application except for the fact that it is used as a stimulant. Okay? Ginagamit siya as stimulant. But other than that, hindi na maganda yung effect ng nicotine sa body. The target is the cardiovascular system. So the patient may have hypertension and other diseases, or other cardiovascular diseases. That's for nicotine. So I advise you to stop that. For example, ngayon nagsa-start na kayo na magbisyo with the sigarilyo. Ayun, na ninyo siya. Yung undangan na ninyo siya. Nicotine does not really cause cancer. It's not nicotine that causes cancer for smokers. The one that causes cancer for smokers is the so-called tar and the benzopyrene. Tar, T-A-R, and benzopyrene found in the filter of the cigarette. That one causes both cancer in the mouth area and at the same time cancer in the lungs. But nicotine is not, though nicotine is like deposited in the teeth of persons smoking, but the effect of on the body is more on the cardiovascular system. Yeah, hindi din pwede na mag-quit ng smoking yung ating patient and then mag-shift siya into gums or patch. Kasi ganun pa rin yun. The patient is receiving nicotine in his or her own body. And since there is the presence of nicotine, then there is effect in the cardiovascular system, including the blood pressure. Okay? So as much as possible, if ngayon pa lang nag-start, they can easily stop the bisyo. Pero kung chain smoker na mahirap yon. So ang ginagawa niyan is gradual na pag-stop. Meaning, i-taper ang dose. Okay? Sa vaping, ano ang difference? I'm not really that familiar with the vape, no. I just know that it is an e-cigarette and that there are vapes na merong nicotine and then ang ibang vapes walang nicotine. So kung walang nicotine ang vape, I think that would be okay since hindi nagre-receive ang body ng nicotine, walang effect on the cardiovascular system. But I'm not really familiar with the other contents of the juice they use in the vape. Okay? So I cannot speak for that. Hindi ko alam ano yung ibang content. But kung sa sigarilyo pa yan, yung filter yung merong tar and benzopyrene that can cause cancer. I'm not sure with the vape though if anong other chemicals exist there that might be harmful in the body. Okay? So, yun lang yung masasabi ko sa vape. And mas natatanggap ko actually yung amoy ng vape kasi juice ang ginagamit nila, no? And then they can choose kung anong amoy ng binubuga nila na usok. Hindi ko talaga matanggap ang amoy ng sigarilyo. Yung sa vape kasi may mga kakilala akong nagve-vape, mas natatanggap ko siya. Though hindi ko pa rin siya gusto pero mas natatanggap ko yung amoy ng vape kesa sa sigarilyo. Hindi ko lang alam though if meron pa rin siyang content that can cause cancer or that can cause harm in the body. Okay? Hindi ko alam din bakit nagpapausok. Hindi ko kasi hindi ko siya ma-comprehend why do we need to, like for example, syempre we should not be doing smoking, but I cannot comprehend bakit kung hindi tayo nagsusmoke, bakit tayo magbe-vape, bakit tayo magpapausok sa sasakyanan, magpabulhot. Cool kid. That's the reason why they do that. Doesn't make them cool. Kana jud dili jud nako madawat ang person na naga-smoke jud class. Siguro madawat pa nako ang nagainom since I don't drink, 'di ba? Madawat pa nako ang nagainom pero kanang naga-sigarilyo palayo kay baho kayo sa nga tanan. Anyway, sige, the second classification or etiology for hypertension is secondary hypertension. So, itong secondary hypertension, merong known cause bakit tumaas ang blood pressure ng ating patient. And tumaas ang kanilang blood pressure due to diseases or conditions. Example, the Cushing syndrome, the pheochromocytoma, and the primary aldosteronism. When you say Cushing syndrome, the person has a tumor in the pituitary gland in the brain, and that tumor releases a lot of ACTH hormone. And this hormone, you take note na lang ha, kasi you know me na pag slides ko, I'm not fond of having a lot of like words in my slide. So you can still see words here, but most of the time, this is very, kanang summarized. Okay? So, muna siya ang ginaingon niya pag ako inyong maestra sa pharmacology, ready yun dapat mo mag-take note. Kay dili ko ganahan o magbasa ko sa akong slide. So again, let's talk about Cushing syndrome. When you say Cushing syndrome, the person has a tumor in the pituitary gland. And this tumor releases a lot of ACTH hormone. And then this ACTH hormone, ang effect nito is it will signal the adrenal medulla. Remember the adrenal medulla, the endocrine gland located just above our kidneys. This will trigger the adrenal gland to release a lot of cortisol hormones. Cortisol hormone ang nire-release niya. Now, this cortisol hormone is responsible to a lot of metabolism processes in the body. Metabolism of carbohydrates, of fats, even our sleep-wake pattern is also governed by our cortisol hormone. And by the way, cortisol hormone is commonly known as our stress hormone. Okay? Stress hormone ang common na tawag sa ating cortisol. Now, kapag dumami itong cortisol class, marami siyang effect in the body, series of effects, but one thing is like related here kasi yung series of effects niya sa metabolism can increase the blood pressure of a person. Therefore, naging cause ng hypertension itong Cushing syndrome. That is why it is included in the secondary hypertension. Okay? So again, cortisol class is our stress hormone. It's responsible in our sleep-wake pattern. Actually, before waking up, this cortisol level increases. That will signal our body na magmata na ta. Okay, mo na siya ang ginahimo sa ato ang cortisol. However, if you are a student and then like me, we have disrupted sleep-wake pattern, meaning our body clock is not really normal. So, murag lisod ang trabaho sa ato ang adrenal medulla in releasing the cortisol here. Okay? Anyway, aside from Cushing syndrome that will lead to increase in the blood pressure, we also have pheochromocytoma. And I guess I mentioned this last time sa inyo. Pheochromocytoma naman is a tumor in the adrenal medulla. So what's their difference? Cushing syndrome, the tumor is in the pituitary gland, while the pheochromocytoma, the tumor is located in the adrenal medulla itself. And this tumor triggers to release a lot of norepinephrine and epinephrine in the body. And you know that these two are ligands of our alpha-1 receptor, which I mentioned last meeting. The alpha-1 receptors class major location is the blood vessel, and stimulation of that receptor leads to vasoconstriction, which in turn leads to increase in the blood pressure. Therefore, one effect of pheochromocytoma is the increase in the blood pressure, and it has become a secondary hypertension na kasi meron siyang specific cause. Okay? And then lastly, we have primary aldosteronism. I'm not sure if you are familiar with aldosterone. Wait, let me write sa screen. Ayan. Aldosterone. Aldosterone is a mineralocorticoid that is produced by the adrenal medulla pa rin. Okay, si adrenal medulla pa rin ang nagre-release ng ating aldosterone. And ano ba ang activity ng aldosterone? If you have a lot of aldosterone, its function is to it's for the retention of salt and water in the body. That's the activity of our aldosterone. Now, what happened to you if you have water and salt retention? Your water and your salt will remain in your blood. You will have more volume sa blood mo. But remember that our blood vessels do not adjust. So, the more na daghan imuhang dugo class, the more na nanginahanglan na siya og taas na pressure para mag-flow. Okay? So, unsa tong problema anak karon? Taas ang blood pressure sa person, kailangan niya og taas nga force to let the blood flow kasi masyadong marami. So, tataas yung BP, and at the same time, ito yung mga cases na the patient may experience edema. You know, edema, right? Manghupong, kung sa Tagalog, magmanas. I'm not sure with the Ilonggo though, kung sa'y tawag sa Ilonggo. Basta manghupong, magmanas, that's edema. The water will be pushed out to the tissues kasi hindi na siya kayang ipa-flow sa ating blood vessel. So pag merong primary aldosteronism wherein the adrenal medulla releases a lot of aldosterone, water and salt will stay in the body, stay in the blood, leading to the increase in the blood pressure. Maghabok, amo lang na sa Ilonggo, basta maghabok sa mukon. So what's the difference between inflammation and edema sa Ilonggo? Oo, fluid ang edema. Fluid ang edema, and yes, inflammation is magbukol. Okay? Kasi merong example, infection. Ganun. Questions about this etiology? But then again, if the hypertension has a known cause, it will fall under the essential or primary hypertension. Okay, now let's talk about the adrenal medulla or the adrenal cortex. The adrenal cortex is a part of the adrenal medulla. Kasi most of the cases involving increase in the blood pressure involves this endocrine gland. So itong adrenal cortex of the adrenal medulla releases mineralocorticoids, glucocorticoids, and our sex hormones. Itong mineralocorticoids and glucocorticoids class are two types of corticosteroids. Okay, so our body class has the ability to produce corticosteroids. So dalawa yan ha, mineralocorticoids and glucocorticoids. Yeah, magtaas ang BP sa primary aldosteronism. Let me just get my pen ha. I want to write sa lisod lang guning kanang alternate bitaw ng na klase face-to-face sa school, tapos na online, and then alternate. Kasi kung dala-dala sa akong bag nga na ay pen, mga hakwat, gikan sa among balay, balhin sa eskwelahan, tapos gikan sa eskwelahan, balik na po sa balay. So just like today, I'm now in our house. Pero, syempre, later we have our laboratory class, magpa-school na sa ko. Ako kasabot sa kong life. Nga na. Ara lang ha, primary aldosteronism increases blood pressure. I'll explain that later. Okay, now, corticosteroids. What do you know about corticosteroids? What do you know? Ano yung alam niyo about corticosteroids? Siyempre, you encountered a lot of them during your internship. Lagan dyan na ito, yung tubag niyo. Anti-inflammatory drug siya. That's what you know with the corticosteroids. Sige. NSAIDs are different. Kaya nga siya tinawag na NSAID kasi non-steroidal. Meaning they are different from corticosteroids. Okay? Pag NSAIDs, non-steroidal anti-inflammatory drug. So like we have examples, ibuprofen, mefenamic acid, aspirin, not aspirin, sorry. Erase. Wala si aspirin. What else? Etoricoxib, celecoxib, diclofenac. That's the example of the NSAIDs. They are considered non-steroidal, pero they are still anti-inflammatory drugs. Pero yes, that is correct. Our corticosteroids are anti-inflammatory drugs. Okay? Pero steroidal has steroid. In your pharmacognosy, I think sa pharmacognosy kasi ito na-learn, paano niyo malalaman na ang isang substance ay steroid? Kasi yung NSAID non-steroidal. Ito, mga steroids to sila, corticosteroids. How do you know na the drug is a steroid? Yeah, tama yun siyang example. Prednisone is a corticosteroid. Celecoxib though is an NSAID. NSAID ang celecoxib ha, it's not a corticosteroid. Prednisone, prednisolone, hydrocortisone, butametazole. Those are examples of corticosteroids. Mometasone. I hope you encountered them in your internship. Sige, no one knows how to know if a substance is a corticosteroid. Anong meron sa structure nila? Oh, corticosteroid is a steroid. Yeah, but we have different types of steroids. We have the so-called anabolic steroid, which they use for the body, like yung sa mga athletes, pero bawal yun, di ba? 17 carbons. Char. Class, you can call a substance a steroid if the structure contains the CPPP nucleus. Okay? This is a board exam question. What do you mean by CPPP nucleus? If you see this one, meaning of CPPP, cyclopentanoperhydrophenanthrene. Ay, lubat. Wait. May mamatay. Okay, let's continue. Asa na ko? Cyclopentanoperhydrophenanthrene. Ay, threne. Okay, this is one word. So, anong mukha nitong CPPP nucleus? Kita. Mas madali ito kung kapakita ko na lang sa inyo. Pwede naman i-google ang mukha ng CPPP nucleus, no? Wait lang. Gawin ka din, Okay. Cyclopentano perhydrophenanthrene looks like this. We have 3 benzene rings, and then we have on the last part 5-membered ring. Yeah, pentano. So we have here the 5-membered ring on the terminal side. So ito yung mukha ng CPPP nucleus. If ever you see this in the structure of a drug, the drug will be classified as a steroid. Okay? It will be considered as a steroid. So the corticosteroids that we know all contain the CPPP nucleus. So again, you know that it is an anti-inflammatory drug. However, yung mga NSAIDs natin, they are still anti-inflammatory, but they don't have the CPPP nucleus. Okay? So hindi sila steroids. Okay, so let's continue. Sige. So our adrenal medulla releases mineralocorticoid, and one example of that is the aldosterone. And then it also releases glucocorticoids. Ano kaibahan nilang dalawa? Pareha silang steroids, but ito is more on water and salt regulation in the body. And these glucocorticoids is more on a metabolism, like carbohydrates, protein, and even fat metabolism in the body. And this one is more involved on inflammation, and at the same time immune response. Kasi please take note, class, that our corticosteroids, aside from being an anti-inflam, they are also considered immunosuppressant. Okay? Ano nagkadimawa kung agi, dili siya magtarong og agi nga naman. Okay, immunosuppressant din ang ating corticosteroids. You're back. Okay, you're back. Do you have questions? Let's talk about corticosteroids some other time kasi kay daghan kay na sila. Anyway, sige, let's focus more on the increase in the aldosterone since ito yung mas may activity on the blood pressure compared to the glucocorticoids. So again, an aldosterone class, anong ginagawa niya sa body, sa iro? It can increase sodium and water retention or reabsorption. So supposedly, this sodium and water should be excreted via the kidneys, no, in the urine. However, if you have a lot of aldosterone from the kidneys, the salt and the water will be reabsorbed back in the body. And that will lead to the increase in the volume of our blood. So as you can see, our blood vessels does not really adjust. So parehas good sa hose sa tubig kung magbilid ta. Wala nag-a-adjust ang hose, pero pag ginapakusog na to ang gripo, you can really see there that there is increased pressure. So ganun din yung mangyayari sa ating blood vessels. So merong activity si aldosterone dyan in our blood pressure. Questions so far? Wala. Wala pangutana. Pero nagyud ha. Mag-asyong baya kung nagkasinabot akong wala ga pangutana ba. Sige. So let's talk about the blood pressure. Normal regulation of the blood pressure. We have actually the equation for our blood pressure. Blood pressure is equal to CO times PVR. CO is cardiac output and PVR is the peripheral vascular resistance. We don't compute this, how we don't compute this. It's just an equation. What will contribute to the increase or the decrease in the blood pressure? Number one, it's the cardiac output. When you say cardiac output, it's the amount of blood pumped by the heart in a specific time. For example, in 1 minute, how much blood is pumped by the heart? That's the cardiac output. Therefore, pag tumaas yung inyong cardiac output, marami kang blood, no? Tumaas yung volume ng blood mo. Pag tumaas ito, syempre tataas talaga ang blood pressure. Okay? Sabas, pero inano na siya. Pwede pa ulit sa later, sige, later. I'll repeat that. And then PVR is peripheral vascular resistance. What do you mean by this? It's the resistance of our blood vessels for the passage of the blood. Okay? So, syempre, from the heart, ikaw ba mag-drawing of heart? So, na lang, no? I-pump man na niya and it will be received by our blood vessels. So, dinha mo agi ang ato ang blood. However, our blood vessels also has the so-called resistance. It can resist blood flow. So, if tumaas yung resistance niya sa blood flow, then tataas din ang blood pressure. So once again, increase in the cardiac output and at the same time increase in the resistance of the blood vessel will really lead to the increase in the blood pressure. So bakit magre-resist ang ating blood vessels ng blood flow? In cases of there is vasoconstriction, magre-resist talaga siya kasi nag-constrict nga siya, maliit siya. So paano siya makaka-accommodate ng blood if nag-constrict siya? And it's the same thing. Vascular resistance. It's still vascular resistance, blood vessel resistance. Pero kung systemic, it's more on the heart. Itong peripheral kasi, it's outside the heart. Okay? Outside the heart. Meaning our blood vessels in our body outside the heart. Our own heart also needs blood for it to keep working. We also have the so-called cardiac blood vessels na tumatanggap ng dugo. So kung merong problems in our blood vessels, it can also resist blood flow to the heart, leading to heart failure. So kung yan ang mangyayari if you have systemic vascular resistance. Okay? I will talk more about the sodium and the water retention if we're going to talk about diuretics, ha. Ay dito na siya ma-fall sa diuretics. Wait a minute. Okay. May question siya. Wait lang, dun ha, kay nasa baan, di ko sa mong iro. Sige. So, aside from these things, aside from the hydraulic equation of the cardiac output and the peripheral vascular resistance, other things also contribute to the regulation of our blood pressure. That includes the vasoactive substances produced inside our body. So example, if our body produces a lot of endothelin, endothelin class is a substance responsible in vasoconstricting or vasoconstriction. It can constrict our blood vessel, and you know if there is a constriction in the blood vessel, it will lead to the increase in the blood pressure. However, if our body produces a lot of nitric oxide, then there will be vasodilation. So actually, we have a lot of drugs that the mechanism of action involves the release of nitric oxide. So marami tayong mai-encounter. As we move on with our lessons sa ating mga antihypertensive agents, we will get to know them. Ano yung mga drugs na merong mechanism of action involving the release of nitric oxide? The goal is to dilate the blood vessel to accommodate a lot of blood, okay? To decrease the blood pressure. And then also, we have the RAAS, renin, angiotensin, aldosterone system. So I don't know if you are familiar. Actually, I believe you are very familiar with the ACE inhibitors and the ARBs. Yan sila mga drugs na yan. Dito yan sila. Ang mechanism of action nila is on the RAAS. I'll explain that to you sa sunod. Isa-isahin lang natin ha kasi masyadong marami yung mga antihypertensive agents natin. However, remember the meaning for ACE is angiotensin converting enzyme inhibitor. And ang meaning ng ARBs is angiotensin receptor blocker. So dyan yung kanilang mechanism of action. Yung mga ACE inhibitors natin, yun yung mga drugs na nag-e-end sa pril. Like captopril, perindopril, fosinopril, basta nag-end sila sa pril. And then yung ARBs natin, yun yung mga drugs na nag-end sa ending sa ARBs. Are you familiar with the ARBs? Sa ending sa pangalan nila, kung ACE inhibitors end with pril, how about the ARBs?
Sartan.
Sartan, very good. So we have the losartan, telmisartan, olmesartan, and the likes. Okay? So, ano na sila? They operate in the same system with the ACE inhibitors. Okay? And then, kidney response to low blood pressure also regulates our blood pressure class. Yung kidneys natin mismo. So, dugtong yan sila. Kidneys and the blood pressure works together. Therefore, if we have problem with our blood pressure, kidneys will be affected. And the vice versa. So, for example, we have injuries in our kidneys, problems sa kidneys natin, that will also lead to abnormalities in our blood pressure. So, the other way around yan. And we have the so-called postural baroreflex. Let's talk about that first before we'll move on to other things that regulate our blood pressure. We have, again, the postural baroreflex regulates the moment-to-moment adjustments in our blood pressure. When is that? When we are going to change our position from reclining to an upright position, like when we lie in bed and then suddenly we get up, class, there is a change in our blood pressure there. When we sit down or when we get up, may change in the blood pressure dyan. So, ang responsible for the regulation of that moment-to-moment adjustments or changes in our blood pressure is the so-called postural baroreflex. Kasi for example, naghigda ka, nikalit kag tindog, you might have increase or decrease in the blood pressure. So this postural baroreflex will correct your blood pressure and take it back to the normal level. Now, where can we see our postural baroreflex? It's found there in our carotid artery, and dyan nakikita si carotid sinus, yan yung postural baroreflex natin. So kaya class, yung mga people with like hypertension, di ba? Sa ilahang ginareklamo pirmi sakit ilang tangkugo, di ba? Sakit ilahang tangkugo kasi naa din ha class ang atuang postural baroreflex, and the increase in the blood pressure cannot be regulated anymore by the postural baroreflex. Okay? So muna sila I'm not really sure, pero magsakit ba or magalay lang ang ilahang tangkugo. And that is the reason why also you really have to protect your neck, kasi pag naglaslas ka tas imong gilaslas din nga part, patay jud ka. Kasi again, nandyan yung ating carotid artery, nandyan yung postural baroreflex that will regulate our blood pressure. Okay? So, meron, sada magkaon daghan durian. Magsakit ang batok. Yeah, magsakit ang batok. Munang mga pagkaon natin na tawag na putok batok, no? Yeah, salty foods can cause hypertension. I'll discuss that later also, if I still have time. Bakit? Masarap ang bawal? Plus, I have this, I know someone na, not really na, acquaintance lang. She was our lecturer sa review. Sa pharmacology man siguro, during our review sa Manor, she was a doctor, and siya, party people siya. So there was the one time na nagparty-party sila with friends. Tapos ang isa nila ka-friend kay as in nawala bitaw ang consciousness as in sa kahubog, and there was a very drastic decrease in her blood pressure. So kato nalipong, and then dalaon na sila sa sakyanan kasi dalaon nila sa hospital, but they are wasted since nasa party sila. Tapos katong doktor, bright kay to siya nga doktor, as they move from the venue to the hospital, naalala niya sa iyang kahubog na doktor di ay siya. Nakatawa ko sa iyang story, naalala niya nga doktor di ay siya. So, gipilit niya iyang sarili mag-isip, kay dili pwede maabot sila sa hospital and people will recognize her nga, uy, doktor niya, wasted ka, yung nagdalag patient sa hospital. So, naalala niya sa iyang kahubog si postural baroreflex. Okay, nag-isip niya siya pag maayo. So what she did is gihilot niya, mao nang bawal hiloton ang batok lasa. Gihilot niya ang batok sa sa iyang friend. Ibutangan niya pressure ang postural baroreflex para mo increase ang blood pressure. So, na-amaze ko sa ako kuya niya siyang kahubog na isip pa niya si postural baroreflex. And then actually, na-okay ang iyahang friend after. Hindi na sila actually natuloy sa hospital kasi naging conscious na ang kanyang friend after niya nilagyan ng pressure ang carotid artery ng kanyang friend. So, nga na I don't drink, pero kamupuhon kung maghubog-hubog mo. Parehas na sa iya makaisip ni hapon kay postural baroreflex. So that is the reason why I cannot forget that also. So when like magpamassage mo or magpahilot mo, especially pag hypertensive ka, hindi talaga yan siya ginagalaw there. Kasi putting a pressure in our carotid artery can lead to the increase in the blood pressure. Okay, ayaw ninyo na siya hiluta din ha nga part. Okay, questions? Clarifications? What time is it? It's 8:47. Wala. Sige. So if the postural baroreflex is responsible for the moment-to-moment adjustment of our blood pressure, the one naman that is primarily responsible for the long-term control of the blood pressure are our kidneys. So mo gyud na siya hadugtong gyud na sila pirmi. The kidneys are responsible for the long-term blood pressure control. Therefore, if we have problems with our kidneys, then we also have problem with our blood pressure. Now, how do kidneys regulate our blood pressure? It's through this system. Renin, angiotensin, aldosterone system. Okay? Kasunod ako mag-discuss ha kasi mahaba yan siya na system. Basta you have to take note that the RAAS takes place in the kidneys. And they are responsible for the regulation of our blood pressure. Okay? So how about if the patient has hypertension? So now let's get to know what are our available drugs in the market. First, we have the diuretics, pampaihi. So our diuretics class lower our blood pressure by depleting the body of our sodium and at the same time reducing our blood volume. Yan yung ginagawa ng diuretics. Papaihiin tayo and as we urinate, our blood volume decreases. Kasi nalabas natin ang tubig and at the same time nalabas natin ang sodium. So that explains now why salty foods are not really recommended for patients having hypertension. The more salt that you have, the more chances of you having hypertension. And then, yan ako magsulting ano. And then we have sympathoplegic agents also. They lower our blood pressure by decreasing the resistance of the blood vessels to blood flow. Meaning of that, they can cause vasodilation, relaxation of our blood vessels so that they can accommodate more blood. And at the same time, sympathoplegic agents can also inhibit cardiac function, increase venous pooling, yung mga veins natin can accommodate blood, and they can have capacitance, increased capacitance level, meaning yung capacity nila is tataas for blood. Okay, so from the name itself, sympathoplegic agents, we are talking about the drugs involved in the sympathetic nervous system. Okay, so that is the reason why nag-review talaga tayo ng parasimpa before tayo mag-move on sa ating people 2. Babalikan natin sila isa-isa, alin doon yung involved in the blood pressure. Okay, and then we also have direct vasodilators. When you say direct vasodilators, they have nothing to do with the sympathetic nervous system, but if we are going to take these drugs, they will directly affect the blood vessels and they will dilate them directly. Therefore, if there is the dilation of the blood vessels, yung ating blood vessels can accommodate more blood. Bababa yung blood pressure. Okay? And at the end of this lesson, we will be talking about agents class that block the production or action of our angiotensin. I believe you know them very well. The ACE inhibitors and at the same time, the ARBs. So that is more on the kidneys. Remember, our kidneys class regulate our blood pressure. Long-term ang kanilang regulation. So, ito yung ating algorithm for patients na merong hypertension and at the same time, may mga concomitant diseases. Meaning, aside from hypertension, they also have these conditions. So, number one, if the patient has hypertension and merong high risk of having coronary disease. Coronary disease means may high risk sila of having problems with their blood vessels in the heart. Okay, in the heart ha. So what are the drugs that can be given to this type of patients? The patients may receive diuretics. The physician may also prescribe beta blockers, ACE inhibitors, and at the same time, calcium channel blockers. So what is missing here are the ARBs. Ito lahat yung mga drugs natin for hypertension ha. So lahat sila for hypertension pero hindi sila lahat pwedeng gamitin sa may mga concomitant na sakit. So the ARBs class may not be given to patients with high risk of having coronary disease. Matatake lang natin yan pag isa-isahin na natin. Isa-isahin ko pa discuss ito ha, so medyo mahaba-haba pa ito. And then we have patients having hypertension and at the same time diabetes. What is missing there are the beta blockers. Okay? So do not give olols to our patients with diabetes. And then for recurrent stroke, nagka-stroke siya, tapos nag-survive, nag-stroke na naman, that's recurrent stroke. So what are we giving to the patients? We have diuretics and at the same time, ACE inhibitors. Therefore, the mainstay here are the ACE inhibitors. Okay, kung nakikita nyo, lahat ng condition dyan, pwedeng ibigay si ACE inhibitors. For patients with heart failure, kompleto yan, except calcium channel blockers. Kasi instead of calcium channel blockers, we are going to give the patient aldosterone receptor antagonists. Okay? You will know them. Puhon. What's the ending of the name ng mga calcium channel blockers? Beta blockers are the olols, ACE inhibitors are the prils, ARBs are the sartan. Now what about the calcium channel blockers or our CCBs?
Dipin, ma'am.
Okay, very good. The dipin, like the amlodipine, nifedipine, nicardipine, those are our calcium channel blockers. So for heart failure, instead of having calcium channel blockers, we'll be giving the patient, once again, aldosterone receptor antagonists. Now, previous myocardial infarction. When you say myocardial infarction, in layman's term, we call that heart attack. So nagka-heart attack ang patient, nag-survive siya. So may previous history siya of having heart attack and then at the same time the patient has hypertension. What do we give our patient? We have the beta blockers, ACE inhibitors, or our aldosterone receptor antagonists. And lastly, for patients having hypertension at the same time chronic renal disease, merong kidney failure, we give ACE inhibitors and the ARBs. Other drugs can injure the kidneys also, so we don't really give them to patients with problems sa kanyang kidneys. Okay? So I think dito muna ako mag-i-end. Actually, sa lahat ng sinabi ko for the whole 1.5 hour, introduction pa lang yun siya. Introduction of what hypertension is, ano yung mga risk factors, what are the things that regulate our blood pressure. Later this afternoon, after our quiz, we will be discussing the diuretics.